check the length of the snake's tail?
Yeah, they're stripping. Okay, good evening. I'll pop out now.
Come here, you leave it like alone. That's a boy, eh? Okay.
Takes about 2 minutes to load.
Casey?
No, it's okay. I'm playing.
Stop it. That's a boy.
Yeah, no, for sure. Okay, let's see how I come in. Okay, good evening and welcome. I got a special guest here. The doc. The doc is on how's it, Gary? The doc is online and she's tripping. And it's not often that we get the chance to be together because a country calls for duty and the rehab calls for duty and the doc being a doctor calls for duty. So hello Leanne, Ina, all the hotties are on here, you know what I mean? I've got the hotties sitting next to me. So wonderful to have you all again. Top of the evening to you, Squire, Ronel, and the doc's just going to speak a bit about her life, and then she's going to duck.
Oh, okay.
And so you can,
that's
yeah,
news.
that's different level.
No,
There we go. Whatever you want to,
No,
where you've gone, where you've toured, where you've been a doctor,
No, man.
you know. So
Yes. No, I'm being put on the spot here.
the Great Barrier Reef. She's from Stellenbosch, so she's not actually shy. You know what I mean?
Now I'll get him back for this, don't worry. Yes, sir. No, I didn't know any about this nonsense. He was just, we'll just quickly say hello for 10 minutes and that's it. What am I supposed to tell?
Of who you are and where you
there's
come
nothing
from,
to
and
tell.
no, there is, and
No.
where you've dived around the world
No,
and where you
man.
visited, and so that people can know who you are. You know what I mean?
Haven't you told him already?
No, never.
Haven't you told me
No,
already
it must-
that how much wine I drink and that I'm a drunk and all that nonsense? I thought you already told him.
No, they think that, yeah.
Yes, see. No, I don't like talking about myself.
Okay. Now she's on a different level. How long you been a doctor? You know, those kind of things. Eh?
It's too long, 26 years. Yeah, now I've been a doctor for 26 years. It doesn't feel like it. I feel like it's been like yesterday that I qualified. But yeah, if I do the maths, it's 26 years. Yeah, then you'll have to ask me questions because I don't know what to talk about.
Okay, then just tell them. I just want to introduce you to them. How long or where all of you traveled around the world.
Basically, I worked in England for a year, but that's long ago. That was 96 to 97. I worked in England and did a lot of traveling while I was working there because I was working 1 week on, 1 week off. So I was on 24/7 for a week and then I'm off for a full week. So I specifically did it that way so that I travel. Because it's very easy to travel from England. I went to like Egypt, Jordan, Israel, Turkey, Greece, whatever, and Europe, a lot of places from England. That was my main mission for that time, is actually to travel. And then I worked in Australia for a year and a half as well. Just traveled around Australia while I was there. Just saw Singapore on the way there and on the way back. Oh.
Okay. And the doc is, she's been very modest now, you know what I mean? I know that I'm the good-looking part of this operation here. And, yeah, no, she puts up with a lot. And Doc, maybe you can explain to him about, before we met, about what your thoughts on of addiction was, etc.
Oh, okay.
I think that's more important than anything.
No, it's changed a lot. I grew up very sheltered and definitely had no idea about addiction at all. I grew up very protected. So I think I probably was I was very ignorant, and I also think judgmental in a way. I used to think, okay, now it's like self-inflicted and just stop doing what you're doing wrong. And I also couldn't understand if someone stopped. Then if you stopped, you stopped. Why start again? It's only actually after I came in. Sorry, just hold on a sec.
Wait.
Sorry, my son is playing here with the dogs. He loves coming to RAEL with me and playing with the dogs and carrying on. yeah, I was very ignorant and judgmental, I think. And after I got in touch with RAEL and got to hear the guys' stories and get to know them and get to know more about the program, it dawned on me, this is a decision they have to make every day for the rest of their life, not to use again. It's not as simple as when you stop, it's done. You have to carry on doing what you're doing right every day, every minute of every day for the rest of your life. And that was quite an eye-opener to me. And also, yeah, the stories I've heard, yes, like some of the stories I've thought, yes, I don't really want to know this. I don't really want to know these things happen. And I've been shocked quite a few times about the depths that addiction take people to, and the depths people would go to for their drugs. And but the other side of that is it's been an absolute inspiration to see once the guys start, okay, and the same goes for women obviously, once they start understanding and the penny drops and they understand what's wrong, what they need to do to recover and to stay recovered. It's amazing, it's miracle level, the changes that happen. And where you see them where they came from to where they are today. Like, for example, Kurt getting married tomorrow. It's absolutely amazing, because the places he's been and the stuff that he's done, and it's a miracle. It's an absolute miracle. And also tonight during the meeting with the guys, Anthony also said that when Kurt came back to RAEL the second time, Anthony actually basically ignored him for 5 to 6 months because he was frustrated with Kurt for having run away the first time. And what's amazing to me about that is that even though Anthony basically ignored him for 5 to 6 months, Kurt stuck it out. And he kept on doing what he needed to do and worked hell of hard to get his recovery. And he's still working hard to this day and plowing that back into all the other guys that's on the farm. He's like really passionate. He's really working very hard to help the other guys help themselves. And now compare Kurt to some of the other people, they might get a negative comment or some actually positive criticism or guidance, and they take it the wrong way and they flip out and decide to leave, or they get mad at Anthony or the other leadership for trying to help them in the right direction. But Kurt, he stuck it out. Even though he didn't have it easy when he came back the second time, he stuck it out, he did what he had to do, and he's still doing that every day today. So I'm very excited for him, for what lies ahead, a wonderful, beautiful future with his family. And we all feel very privileged that we can be here tomorrow and enjoy the day with him.
Yeah, thanks, Doc. And I think the Doc can maybe now explain, unless I want to explain, but I don't want to explain, Pagamiza, is how the Doc met me. Because her version and my version are like two different versions.
Two different virgins or versions?
No, I was a virgin when he met me, but you know what I mean.
Yeah, no, I'm probably not going to be able to talk without him chirping in between.
The truth shall set you free.
Your truth or my truth? Ish, let's see if I can get a chance to tell my version of the story. I was working at the practice in Rawsonville, and just very close to RAEL. And the first time I met him is when he brought a patient to me. I still remember it was a guy who had cholesterol, and he had to come for a blood test, and they forgot that he had to be fasted. So I couldn't take the blood that day, and I said, well, I can come the next day on my way to work. I used to drive past RAEL to work, so I said, no, I'll come and take the blood on the farm. And that's the first that I can remember meeting you. But yeah.
Yeah, and
that was just,
that's not the truth. No, that's the part of the truth.
No, that's the truth.
I'm the only. Hang on here now. I'm the only man. I'm the only man.
I told you that I'm not going to get a chance to tell my version.
I'm the only man in history to have his blood pressure and temperature checked for 3 hours in a surgery, paid for by Benita's medical aid.
Not true. Not true.
I'll call Graham as a witness because he was waiting outside for me to get in the car.
Graham,
You know what I mean?
Graham will just say yes to everything you say anyway, so that's not fair. Take your side. No, that's yeah. And I got more and more involved with RAEL over time as I saw more of the guys, because every time the guys needed a doctor, they would normally come to the practice in Rawsonville. And before I started working there, they went to see the other doctor there when the guys needed medical help. Did she also take her blood pressure for 3 hours?
That we don't speak about the past in that way. And then I must say, oh no, she's not shy, Riaz. But I must say that in this quest, what we're trying to do with UIM and God's calling and that is that she's very supportive. She's immensely supportive. You know, when I tell her like the day before, okay, cheers, I'll see you in a week. It's not like where you going, how you going, what you're doing.
The day before, that day, never mind.
That day, you know what I mean? So we're eating the road now. So, yeah, Dion, een bietjie van minder van 'n ordentlike. Yeah. No, she's not shy. She hasn't had the red wine tonight yet. She's a connoisseur on red wine. No, so yeah, we're happy, and you know, it's whatever's happened in the past between past relationships is done and dusted, and we just move on without slamming, and we don't often talk about the past because the past is gone. It's history, and we're looking for a future together. And when we do get married eventually, we'll probably both be 90, but that's okay.
That's not very far from
Yeah.
now, actually.
No, not at all. Not at all. So as you can see, the dockers are hottie, and then so am I. You know what I mean?
Yeah, you're party.
Yeah, for sure. And total trust, honesty, is what makes this relationship the relationship it is. There's no hidden agendas. There's no ways that I could be with someone doing what I'm doing now. You know, been away for 3 months so far and going away again. And you know about that, huh? I think you do.
You're going to tell me later.
Ja. Regte boervrou. Ja, she's eintlik baie Afrikaans, but she doesn't speak like heavily Afrikaans. And you know, like they say, behind every successful man is a successful good woman, and that's what it is, you know. And we both respect each other's callings. We both respect each other in the missions that we are on, and the support is immense. And we've been together like for many years now. We actually built a friendship because you wouldn't let me bonker. So we built a friendship of about 3 years, and we got to know each other, and that was, I think, the most important part of it. Because like I'm the easiest out to live with, but I am. I don't scream at her or fluke at her. I've never done that in the time that we've been together. Never. She's sworn at me,
No.
but haven't you? Okay.
Excuse me? I've never sworn at anyone in my entire life.
Yeah, that's different level. You know what I mean? Nor have I. And so it's beautiful. You know, she's very humble in the way that she won't tell anyone she's a doctor, but I do. I say, hey, what about the doctor here? You know what I mean? Doctor? Like, where's your doctor? No, she's a medical practitioner. So, wil jy 'n bietjie Afrikaans sê? Okay, ons kan die Afrikaans gooi, daar's nie 'n probleem nie. En ek kan net sê dat die dokter 'n baie gelukkige vrou is om my te hê.
Dis waar.
En ek is baie gelukkig om haar te hê. Maar so dis hoe ons aangaan, and we enjoy each other's company. We don't spend enough time together, but I explained to the calling comes first, unfortunately, but it's the calling because we both believe in God. We both trust God. We both respect God. And we both love God. And so we should be having like wedding bells soon. And strange enough, today and yesterday, we landed in Israel together a year ago. We had a wonderful time around Israel. And the doc loves photography. Now, she takes a photograph of a plant or a flower, and then she takes about 28 shots of it. I said, like, can't you just take 2? You know what I mean? One from the back, one from the front. And she tugged me along Israel that I was hoping for the return of Jesus Christ to come because I was so moeg. Because she had to photograph every angle, everything, every way, every do. So yeah, it was wonderful. It was a wonderful trip. And the doc has been there before. I've been there before. And we're hoping to go back there as soon as they lift the sanctions or the COVID Chinese virus. And the doc's got her version on the Chinese virus. So don't ask her tonight because we're busy getting prepared for Kurt's wedding. And I'm a lucky man. I admit it, I'm a lucky man. Sometimes you mustn't throw all your cards onto the deck, you know what I mean? Because there's a lot of hotties on here, a lot of hotties that follow us, and a lot of hottie friends.
Keep the back door open.
Yeah, you have to. You have to. That is the strategy that we need in life.
No, I don't want to keep it back door. I've cemented the back door.
Is the back door cemented? I'm happy at that. At the age of 56, I'm happy to not leave the back door. So yeah, it's. I just thought I'd show you the doc, and I affectionately call it doc. You know what I mean? And that's the way we roll. A doc with a man who came from the park bench. The doc with a man who's got to stand at 7. But it's okay. It shows you opposites attract. And we have a lot of talks, a lot of fun. And obviously, with time to come, we'll have more fun and more time to be with the other. What we are doing now in the calling and what we are doing to try and change this nation takes a lot of my time away from the people I love, like my mother and my sister and obviously the doc. But the greater purpose is there, the greater purpose of what we're trying to achieve, because what the devil wants to achieve is to break us up. And we have to be on guard at all times. At all times. There's everything I share with the doc. I don't keep nothing from her. Because you want that kind of relationship, especially when you're on the road all the time. I don't let people get dirt on me. And that is the battle that we are fighting between good and bad at the moment. So yeah, anything from you, Doc? Praat 'n bietjie Afrikaans met die mense?
Ai tog. Die jou tipe Afrikaans?
Ja, my tipe Afrikaans. Ken jy hom nie?
Nee, maar dan moet hulle ore toe druk.
Okay.
Now come sit here with me.
Okay.
Nee, ja, wat die Afrikaans praat betref, het was aanvanklik, was het vir my, but will the people understand if I speak Afrikaans?
That's baie Afrikaans, joh.
Okay. Nee, aanvanklik, toe kom leer ken net, en as ek 'n WhatsApp, of, ja, dus, WhatsApp vir hom stuur, of as ek met hom praat, ek kon glad nie met hom Afrikaans praat, ek was so gewoond om, selfs in Engels te WhatsApp, het vir my weird gevoel om in Afrikaans te WhatsApp, maar nou, ja, nee, nou is het Afrikaans en Engels die mekaar.
Ja.
Maar aanvanklik, it felt weird to speak Afrikaans to him. Not so used to speaking English.
Yeah, so that's the way. So now you've met the doc that we always speak about, the amazing doc. And I will tell you the biggest attribute of her, besides that she's pretty and all that kind of shit, all women are beautiful. Yeah, you have to say that. Yeah, all women are beautiful. She's just more beautiful. Is that she allows me to do what I'm doing for the greater good of this country. Without that kind of support, I don't think I would have struggled to continue. I really would have struggled to continue. The doc is also the doctor of my mother, which is important. And with due respect, she saved my mother's life twice. When my mother was in the old age home, my mother was dead. She had no blood in her body, and the doc saved my mother twice. So I'm indebted to her in that department to give her a good life and what she's done for my mother. And she comes here once or twice a week to come and check up on the mom. She checks up on the guys. And yeah, she's a real professional, very humble, very, very quiet in what she does, and just goes about doing what she loves doing. And that's been a help and a caring friend for a lot of people. Doc financed Angus to go on the course for caring. She helps a lot of people in the community. She's not your normal doc that walks away with a stiff tie and think they are like Jesus Christ's sons and all that. No ways. She helps people. She's a humanitarian. And I think that is what attracted me towards her. That she'll always help people. And sometimes I had to stop and say, a different level here. But then she'll trip. And she loves antiques. So please don't give me antiques. Don't say that you've got this grandfather. I'm looking for a grandfather clock, by the way. I'll buy it. And yeah, because the old lady ripped us the other day. So we didn't buy it. Is that she loves antiques. She loves nature. She loves...
It's because I love antiques that I love you.
Yeah, no, yeah. No, I'm
antique.
I know for sure. I'm a different level antique. You know what I mean? I'm one of a kind. You can't replicate me.
Definitely not.
Yeah, so Doc brings a lot of happiness into my life. And in saying that, I'm not saying that my previous marriages and that I wasn't happy in all or certain departments. And I think the Doc just fulfills all the departments for me. All departments. And gives me that free rope to go and do what I love doing, and that is helping people. So it's Pagamiza. Now you've checked the Doc. Okay, she's a hottie. And, the Doc has never made me food.
That's not true.
You've never made me a plate of food.
Hey, that's not
Maybe
true.
once.
No, that's
Lamb
not true.
chops you made me.
And
In like 4 years,
and
you know what I
fish
mean?
And chicken.
And ribs.
And
Ribs. Okay. Now her son is defending her. He's 10 years old. He's defending her.
Thanks, Adrian.
No, beautiful. Beautiful children she's got. Beautiful daughter. Beautiful son. And I'm a very blessed man.
I'm the
I can
best
say.
one.
Yeah, I'm a very blessed man. Okay. All right. Thank you very much, and thank you for receiving the Doc so nicely. And I know when I marry the Doc, about 6 or 7 million women are going to start crying, but that's okay. You cry, you'll find the man of your dreams, you know. But I'm a lucky boy.
I'm the lucky one, my
Yeah, I'm a lucky boy that I found her late in life, and brings happiness and joy to my heart. I'm not the easiest man, but I'm not an abusive man. I'm not a man that screams and shouts. I'm not at my girlfriend, but sometimes I just want to leave the house early, and I say to her, okay, well, cheers, we go to the Free State. And she says, okay, enjoy it. Maybe she's got another man who comes in there, who knows, you know what I mean?
Nah,
But I doubt it.
definitely not.
I doubt it. So
Definitely.
we have a lot of fun together. A lot of fun. Okay, Doc.
Yeah.
All right, that's the Doc. You've met her. You've checked her out. And you can see why I'm a happy puppy. She knows I take my work and my calling very seriously. I haven't got time for shit in my life. And that's the seriousness I enjoy it. I get on well with her family, with her brothers, and her mother. Her father's late. Wasn't your grandfather in the Olympic Games?
I was the manager of the 1952.
Lincoln, can you make a plan of those dogs, my bro? You're standing right there. Are you tripping?
My grandfather was the manager of the Springbok athletics and cycling team for the 1952 Olympic Games in Helsinki. Yeah.
And your dad was a professor.
Yeah, and a humble man. He didn't
Yeah,
bother about the professor title.
Okay. So we're obviously coming from a very, very intelligent family. And the Doc often throws it in my face that I'm not that intelligent.
No,
you know what I mean?
That's not true.
She says, yeah, I got 15 A's in the doctor, becoming a doctor, and you didn't even finish standard 7. I leave it like that, I don't get. I stay humble.
I'm not even going to argue with that because it's
Yeah.
absolute nonsense.
And we got a love for dogs together. We got, I think, 21 dogs together. Some at the Doc's house and some here on the farm. So we're on a different level when it comes to dogs. And you've got, what else you got there? You got, Doc loves animals. Got an aviary.
Yeah, that you built, organized,
Yeah,
made happen.
nice guy.
Yeah,
And you got a skunk.
yeah. It's my son's skunk.
Yeah.
And a hedgehog.
And a hedgehog.
The hedgehog.
A bird.
No, what a bird! Lots of birds,
Lots of birds.
bunnies, guinea pigs.
8 dogs.
Yeah,
8
and
dogs.
the cat. Shame done.
And the cat.
Yeah,
And the cat. Someone asked me today about cats. I said, I don't do cats. The cat likes me, but I don't like the cat.
you do like her.
I do like her, but I don't want, you know what I mean?
You like her.
I only like her because I love you.
She likes you.
Yeah, I know.
Yeah.
Most pussies do. You know what I mean? So
Yeah, man. Also,
Ish.
that's the way it rolls. Anyway. All right. Love you lots, and I'll carry on speaking, and the Doc must go home now. And Kurt getting
You
married
chasing
tomorrow.
your-
No,
chasing
not at
your
all.
way.
Not at all. Not at all. Doc, someone did ask there about post-traumatic stress disorder.
Yeah.
If you can just explain, is it how dangerous it is?
No, it can be very debilitating if someone's had a very traumatic experience. They tend to have it can involve different symptoms: depression, insomnia, panic attacks, anxiety. And it can really, if ideally, if someone's had a traumatic experience, it has to be dealt with as soon as possible, preferably immediately. Get counselling and etc. Because if it's left, it can develop into post-traumatic stress disorder. And that can be a very, very difficult thing to manage and overcome. That's just in short.
And Doc,
What else?
I know everyone wants to ask there, and I'm going to put the doc on the spot now because she's the doctor. I'm not the doctor. You know what I mean?
I'm really
I should be the doctor. What are your views on Chinese virus?
Yes. Well, okay. Firstly, it's out of none of us alive today have a frame of reference for what's going on at the moment. None of us has been through something similar before. So there's a lot of things we don't know about it, and I think in 10 years' time we're going to probably say, oh, we had it completely wrong in that or this department, we should have handled it this way or that way. And it's already changed from when it first started as to how it has to be managed to what they're doing now. And there's a lot of conspiracy theories and stuff. I do find the whole thing quite strange, how it came to be, and I really think there's a lot of things we don't know that we probably will never know of how it happened. And then the other thing is how it's being managed, the things around it. I think it's being used and abused for a lot of hidden agendas as well. But the bottom line is, I don't really know. I can guess and speculate and all that, but I don't really know. I did see 2 patients this week that I'm convinced has COVID, and the number seems to be rising here in South Africa again. So hopefully we won't go back to a hard lockdown, but yeah, I think we have to be prepared for that. Whether it's going to be realistic or whether it's just going to be used as an opportunity to control people again, I don't know. We'll have to see. So those who smoke, stock up on cigarettes and be ready this time, and the same goes for the wine, I guess. But I think we can just all hope and pray that this will soon pass. But I do also think in future. Hello, Mrs. Hall. How are you? I do think in future, like the same as with the swine flu and all that, the corona, the major crisis might go over, but it will probably become part of the yearly seasonal viruses that we see, same as like with normal influenza. And like I said, even swine flu, it was many years ago, it was a massive crisis. And everybody was like panicky and all that, and then, but it's still, so it's sort of eased out, and but it's still coming around every now and then. There's a few cases, but it hasn't gone back to the major crisis it was, and I think it might the same might happen with corona.
What's that, Mom?
It's cold.
You want
Angry
a
Mom's
blanket?
cold.
The blanket.
It's cold.
Here, come here. Here's your blanket. Come here, Mom. Angus, bring your blanket. Thanks. Just turn the fans off there, please. Mom's in the house. The Queen is in the house. Angus!
Okay, any more questions, or do you want something?
No, carry on. I'm sure there's some
I've-
questions
I've-
there.
It's difficult to the. I just see someone saying here, Dr. EFF message yesterday, this confuses me on COVID. Yeah, well, they don't work according to normal society's rules. They're not supposed to be doing that. That's absolute nonsense. They no, but if is doing is wrong, everything they do is wrong in my eyes. Sorry. The other day, recently, also we stopped at the petrol station, and there was a taxi next to us, and it was jam-packed, the taxi, and I think like about 2 people in the taxi had masks on. So inevitably, if that's the way it's going, people are behaving, then the numbers will rise again. Like the 2 patients I saw this week that I'm convinced has COVID. The one pitched without a mask. She didn't even come with a mask, and then we gave her a mask there. And after that, and she was like really very sick. I had to send her to hospital, and even after I told her that, now she still wanted to go and withdraw money and go to the shops. And the other patient was a male. He was also very sick. I had to send him to hospital as well. And when I wrote the letter for the referral letter for the hospital, and when I went to give it to him, it was gone. And I asked him, where is he? Now he went to the shops. Now I've already told him I think he's got COVID and he's very sick. Now he goes and walk around in the shops and possibly infecting other people. So I don't think it's necessary to panic. I generally I don't like panic about anything. I think the best thing is like stay calm, but to take the necessary precautions, just be sensible. And some people are just really being stupid. I'm sorry. Yeah.
Okay, and I think there's another one. Stress aware supplement, help with panic attacks, anxiety.
Yeah, you know what? You can try it. If it works, it's fine. For some people, over the counter things will work. If that's the case, that's fine. Because obviously, when it comes to tranquilizers, sleeping tablets, and things like that, the less you use, the better. If you can cope without it, or rather learn coping skills, it's better than taking potentially addictive medication. If you're getting proper panic attacks, like real panic attacks, then it's unlikely that stress away will help. I think you need to actually see a doctor and potentially psychologist and consider medication, but be careful with potentially addictive stuff. Some Ebola and TB is worse than COVID, someone says here. Those the TB is a chronic problem. It's but people tend to generally, after a while, after they've heard TB for a while, or AIDS, then people tend to sort of become blunted. What's the word?
Immune.
Yeah, so sort of. They it doesn't bother them anymore. We get develop a tolerance, or the same as like with the violence in the country. We sort of become too used to it. Yes, TB is a huge problem, but it doesn't spread as fast as it doesn't spread as fast as COVID. So COVID just like went around the world like wildfire. And yes, there's a lot of people dying from TB, and there's a lot of resistance and all that. So TB is a big problem, and it's here to stay. And then with Ebola, yeah, I must say, I think that's quite a horrible thing to get. I think your chances of survival is much higher with COVID than with Ebola, but Ebola is not as widespread as COVID. So you have to think of all those things. It's difficult to compare the one to the other directly and say the one is worse than the other. It's different. It's like comparing pears and apples, really. What helps for gout attacks? Okay, with any illness or any condition, I firmly believe you have to sort out the cause. It's no use just carrying on with what's causing a condition and piling on more and more medication to try and then just sort of treat the symptoms. So if there's things in your diet, etc., that's contributing to the gout, obviously cut that out. And then if you have an acute attack, you can use anti-inflammatories. You can use things like Voltaren. You can use colchicine. That's quite a traditional thing to use for gout. And also cortisone also helps for the acute attack, to help with to suppress the inflammation. So I normally do a combination of medications if someone has a severe acute attack. I often give the patients an injection as well if they anti-inflammatory plus a cortisone, or maybe just the anti-inflammatory, depending on. I prefer to individualize. And then if someone gets regular gout attacks, you can put the patient on Puricos or an equivalent thereof to try and prevent the attacks. But if you have an acute attack, you have to stop the Puricos for that period and treat the acute attack, and then you can go back on the Puricos. But again, still, look at the contributing factors. If too much red wine, red meat, tomatoes, there's a whole list of things, you can go Google it, that can contribute to gout. It's basically a build-up of uric acid in a joint. Yeah. I'm having vaccine 2nd week of December. Would you take it? You mean the COVID vaccine? Okay, generally, I'm very pro-vaccination, and like measles, whatever, the mumps, the usual things that's given to children. I've given my children every vaccine they could get, even the ones that's not on the schedule, like for chicken pox, etc. But I am very, very wary about the COVID vaccination. I'm very wary about that. They're pushing it through way too fast, as far as I'm concerned. There's just too many things around it. At this stage, well, everybody has to decide for themselves, but at this stage, I won't be giving it. I hope I'm not causing nonsense now, but no, at this stage I prefer to stay away from that. There's too many things that bothers me about the whole COVID vaccination thing. I first want to see. I first have to let it be around for a few years before I'll just take it. Yeah, vitamin C. I think vitamin C is good for your immunity, but not more than 1,000 milligrams a day. Some these people who believe that scientists that believe if you go over 1,000 milligrams a day, you actually get the oxidant effect instead of antioxidant. I'm not sure. I'm not sure if that's really the case or not. But yeah, I think you need more than just the vitamin C actually to help with COVID, and you still have to take the usual precautions: social distancing, the mask, washing your hands regularly, etc. And it seems that some people are just more susceptible to it than others. Like my one cousin is battling with COVID. He's been sick for more than a month, and he's a very fit and healthy person. And he got really sick from it. He's still struggling, and his wife didn't get it at all. So yeah, and she was with him the whole time. So there's a lot we still need to learn about COVID. Yeah, vitamin D is also. It's quite a thing nowadays that they're focusing a lot on vitamin D. Vitamin D is important, but it's one of the vitamins that get it's fat soluble. So if you take too much, it heaps up in your body. So vitamin E, D, E, and K, those you shouldn't take more than you're supposed to, because it heaps up in your body, and that's also not good. So it's not one of the water soluble ones. But vitamin D is important, it's good, and especially like in countries where they don't have a lot of sun, they're more likely to suffer from vitamin D deficiencies than people who do get a lot of sun. What is your take on the mask? I think it's in terms of COVID. I think it's a good thing to wear a mask. Personally, I hate the cloth masks. I can't breathe with it properly. Surgical masks I find more comfortable. It will definitely never. It is not 100% guaranteed, but it does decrease your risk. But obviously, the more people wear it, the better for everybody. Yeah. But it's not a full-on guarantee. But I think we should try what we can. But it's also now the flu, normal flu, the numbers have gone down drastically this year. But it's because people are social distancing and washing their hands and wearing masks. So people definitely through this winter got sick a lot less from other things. But it's because we were taking precautions that generally help for other things as well. Is Anthony sick? He has a cough.
Level.
Yeah, I normally when he mentions the
Yeah.
cough, obviously I talk about the smoking and he doesn't want to hear that. Yeah, no, he's not sick. It's a chronic cough he's got, and personally, I think the smoking is a major problem there. Yeah.
The irritation.
Yeah, but we're working on that one. But I don't wanna nagging. I don't wanna be a pain. But if he asks me, then I'd give him my honest opinion. As Kleinboet as well.
Hi, all 300 and odd people.
My eldest and naughtiest son. Yeah. Is sleeping pills bad to use? First choice is again to try and get your sleeping pattern sorted in other ways. Try and stay away. Prevent things that can interfere with your sleeping. So it's not good to like fall asleep in front of the TV and then get up and go to bed. It's not good to sit on your cell phone for ages and before you go to bed, because that does keep you awake. It does play a role. So we do a lot of things wrong nowadays that can interfere with your sleeping. And also taking stimulants, caffeine, coffee, Coke, etc., Red Bull, other energy drinks. A lot of people, if they just sort out the causes or contributing, it's just not always causes, but contributing factors to bad sleep, then you can already get a long way in terms of helping with your sleeping pattern. I do prescribe sleeping tablets if nothing else works. You also get things like melatonin. Circadian is one of the brand names. That's safer than your traditional proper sleeping tablets. So it's not that I don't prescribe it, but it has to be used with caution because it is potentially addictive. How about out of line due to my age, was not allowed to go to work. Okay, if you're tired, again, there's a lot of things that can contribute to that. Iron levels, thyroid can sometimes be a problem. Maybe if you're not sleeping enough, if you're not eating healthy, there's so many things that contribute. So you can try tonics, you can try supplements, you can try something like vitamin B injections. You get vitamin B in high doses in Neurobian tablets. That's about the highest dose of vitamin B you'll get in a tablet form, and that has to be taken. You don't need a script for that, but that's kept behind the counter. You can't buy it off the shelf. So you can go to the pharmacy and ask for Neurobian tablets. They'll give it to you without a script. So that might help, but nothing will help if there's something, a medical underlying, if it's an underlying medical problem. So vitamin B injections, for example, won't help if you have an iron shortage. But also you shouldn't take iron tablets if you don't have a proven iron shortage, because if you take it, if you don't need it, you can get iron overload, and that's actually dangerous. What was that one? This Malema is the cause of my sleeplessness. Are you suggesting I cut him out? Oh, for sure, yes. Just cut him out. Finish and clear. You don't even have to look for a reason. Yeah.
Okay, so that was the doc in the house. Been on CBD for 5 years now. You still not about melatonin back. Do you need a script for a vitamin B injection?
You actually do. It used to not be like that, but I can't remember when, a couple of years ago, they changed it that you need a script for vitamin B injection. It wasn't always like that. Yes, I know you need a script for that. It wasn't always like that, but yes, nowadays you need a script for vitamin B injection. But what you can do is you can ask your doctor, whoever gives you the script, to put repeats on that. So you don't have to go get a script every single time you want to go for an injection. Yeah. But you need a script. Yeah.
And then Natasha's insomnia.
Yeah, again with the insomnia, as I said, try and look at anything that can contribute to your problem to sleep. You have to get a good sleeping routine, sleeping pattern. So try to go to bed at a certain time. Don't put the cell phone, laptops, TV, everything away at least an hour or two before you want to go to sleep. Rather read a book or something. I know that's not like in nowadays to read a book. Everything is done on the cell phones, but it's actually not good for your sleeping. And as I said, avoid stimulants, any form of stimulant. Some medication have stimulants in, like some cough mixture have stuff in that can keep you awake. Some sinus and cold and flu medications have some painkillers as well, have caffeine and things like that. And so make sure you avoid things like that. And if that doesn't help, then start with things you can buy over the counter, like herbal things or whatever. Try that first, or something like melatonin. And only if that doesn't work, then you can consider medication. But then again, you have to be have to be careful with addiction and stuff.
Okay, so there was free consultations, and I was wondering if any of you had doctors.
Oh, sorry, I just want to mention something else.
Yeah, the doc wants to come back in the house.
Sorry. There's something else with the sleeping. A lot of people, they take a alcoholic drink in the evening with the idea to help them sleep. The problem is, especially if you overdo it, in the long run, alcohol makes your insomnia worse, and it makes things like depression worse. That's a definite. It definitely makes it worse. So if you have a glass of wine in the evening or a tot of whiskey, whatever your thing is, that's fine. But if you overdo it, it will make you might fall asleep at that moment because you zonked, but it will just get worse. It will, in the long run, it will make you insomnia, depression, in any psychiatric conditions, it will make worse.
Okay. Okay, Doc, can my blood pressure meds keep me awake if you take it, say, 9 o'clock?
Normally, I'm not specifically, but it's not impossible, but normally most people take their blood pressure medication in the morning. Some people take medication twice daily, but yeah, that shouldn't be too much of that on its own shouldn't be a problem.
Okay, thank you very much to the doc. Any other future medical questions later, I will answer. And I'm sure...
the gynecology and urology.
I know everything. You know, I'm trained in most things without having a certificate. So thank you, Doc, for giving of your time, your expertise to the people. And maybe once a month or so...
I see someone says magnesium. I think magnesium is good. You just have to be careful with magnesium or any mineral supplements. You may have to make sure you're taking enough fluid as well. You don't have to drown yourself, but you have to take in enough fluid if you're taking mineral supplements. Otherwise, there's an increased risk for kidney stones.
Okay. All right, then, Doc, just a question from me. A friend of mine, it doesn't affect me, is erectional dysfunctional.
What about that?
What is the cure? Erectile dysfunction. What is the cure?
Get a blood transfusion from Anthony.
Okay, that's all right. Okay. We want more, Doc. No, I'm sure we can arrange for maybe a one day every month where the doc can come on and she can just answer questions. Remember, the doc is answering from her experience, because we've had this before, and obviously a person has to be seen by a doctor to get the correct diagnosis. This is just like a kind of a guideline, because like don't go and say, okay, well, the doc said this and this is the way it is, but meantime you've got like herpes or VD or something, you know what I mean? Because that could contribute. Is there a lot of sexually transmitted diseases that you see, doctor?
Yeah. depends on where you work. The practice where I worked,
Williams.
where I got to know Anthony, but that's obviously got nothing to do with Anthony. But I saw a lot of sexually transmitted disease there. Yes.
Thank you, Anthony.
And then the thing is, people tend to what I find often then people they would have had some a thing that happened, and then they're worried about they might have picked up AIDS or whatever, and they stress themselves to pieces. And then you do the test and it's negative, and then they think, okay, that's a green light, they can just carry on as before. So I normally, if someone comes to me and they're panicking, they might have picked up this disease or that disease, I first talk to them about it and just explain, listen, but okay, I hope and believe that this is going to be negative, but even if it is negative, it doesn't mean you can just go and carry on as before, because eventually you will. If you keep on playing with fire, you'll get burned. So I just try and counsel them and try and convince them to change their ways to not end up with unnecessary trouble.
So in other words, you've seen many a dick in your life.
Not because I wanted to.
That's on a different level, yeah.
Speechless.
Yeah.
Yeah. I saw someone asked if they could WhatsApp me for advice. I just can't remember that number now. Let me just.
I'll put it on later.
Okay, yeah, there is I have a number that people can WhatsApp me on. So it's not my main number that I it's a phone that I keep out for that. So a lot of people have been WhatsApping me on that number. I'm not taking any calls on that number, otherwise I'll just be on the phone the whole day. So people can WhatsApp me for advice on that number. And obviously I answer as and when I can. I because that's in my own free time that I'm doing that. So as and when I can, I answer those. So if I don't answer immediately, I think I am a bit behind at this stage because I've been a bit overwhelmed with WhatsApps lately. But I won't ignore you. As and when I can, I'll answer those. And it's only for giving advice. I'll give advice, but I can't. It's unethical for me to give scripts or anything to people that I haven't actually consulted personally and examined. So it's advice and maybe just to guide in the right direction of who you should go to or what hospital or how the system works or whatever. Right? Yes, I've heard a few shocking things actually in terms of experiences that people have had with hospitals and the care that they get. It actually upsets me terribly. For example, I saw I was WhatsApping a woman recently. She was like very sick, and she had in the past that she's had problems with her liver in the past, and then she went to the hospital the one day. They didn't see her. And then she had to come back another day, and then they did see her, and they said to her, she's sick because of her liver again. But it doesn't sound like they actually did any tests. So that's So you can't just come up with that opinion if you didn't actually examine the patient. And on top of that, okay, they said that she's got a problem with her liver, but then they gave her Panado. And if someone has a problem with their liver, you do not give them Panado because that goes through the liver. So for someone who's got a liver problem, Panado is poison. So I was just gobsmacked. I was very upset. So I don't know if sometimes it's a lack of knowledge, if it's still an inexperienced doctor, or whether people just don't freaking care. I don't know. That upsets me.
Different level.